How do families handle ethical dilemmas in prenatal screening? Imagine finding out that your unborn baby might have a genetic condition. It's a moment filled with hope, fear, and tough choices. Families facing these situations often wonder what to do next. Prenatal screening tests, like blood tests and ultrasound scans, can tell us about the health of the fetus. These tests can detect genetic variations or anomalies that might cause health issues later. But sometimes, the results are not clear-cut. They can be uncertain or incomplete, which makes decisions even harder. Families then have to decide how to interpret this information and what steps to take. The first step many families take is learning about the tests themselves. They need to understand what the screening can and cannot tell them. For example, non-invasive prenatal testing uses a small blood sample from the mother to look for signs of genetic conditions like Down syndrome. These tests are safe and usually take about 1 to 2 weeks for results. Invasive tests like amniocentesis or chorionic villus sampling involve a small needle and carry a tiny risk of miscarriage. Families often weigh the risks and benefits before choosing a test. Once results are in, families usually seek guidance from healthcare providers or genetic counselors. These professionals help explain what the findings mean and what options are available. Sometimes, the results show a high chance of a condition, but not a certainty. This uncertainty can cause a lot of stress. Families might need time to process the information and discuss it with loved ones. Making decisions about the pregnancy is often the most difficult part. Some families decide to continue with the pregnancy and prepare for possible health needs. Others consider options like further testing or even pregnancy termination, especially if the condition is severe. Timing is critical because legal limits on pregnancy termination vary by location. Families must often make these choices quickly, which adds to the emotional pressure. Throughout this process, families consider their personal values, cultural beliefs, and religious views. Some may feel that every life is valuable regardless of health issues. Others might prioritize quality of life and choose to terminate if the fetus has a serious condition. These decisions are deeply personal and can be influenced by social factors and support systems. Emotional support plays a big role too. Families often seek counseling to help manage feelings of fear, guilt, or grief. Talking with trusted friends, family members, or support groups can make a big difference. They also think about privacy concerns, especially with advanced testing revealing genetic information about both parents. Respecting each person's autonomy and privacy is important during these sensitive times. In recent years, technological advances have raised new ethical questions. Some worry about the societal impact of selecting against certain conditions or disabilities. Others are concerned about the potential for increased pregnancy terminations and societal pressures to conform to certain genetic standards. Families must navigate these complex issues carefully, balancing medical facts with their own moral beliefs. In the end, families handle these ethical dilemmas by gathering information, consulting professionals, and reflecting on their values. They often seek support from genetic counselors and healthcare providers to clarify their options. Their goal is to make decisions that feel right for them, respecting their beliefs and emotional well-being. Navigating these choices can be challenging, but with support and understanding, families find ways to move forward with confidence and compassion.